Hello everyone, I am your host Ritika Bose. Welcome to yet another episode of Health Par Charcha. Today we have with us Dr. Ashwini MBBS MD, who holds specialization in public health and family medicine. She has joined us to enlighten us about the spread of viral infection and its impact on our health. Thank you so much, Doctor, for joining us.
Thank you for having me, Ritika.
Doctor, we would like to know why chilling winter becomes the boiling pot for viral infections.
So, winters particularly are not the only month wherein we have a surge of viral infection cases, right? So, viral infection as such is a very huge term. So, maybe by here you mean that the people who are currently suffering from all these respiratory symptoms like cold, cough, fever, body ache, loss of appetite, lethargy and all of that, right? So, this is a very common viral infection which goes around in the winter. So, the influenza virus functions in a way wherein it has its, cyclical pattern of outbreak. So in some seasons like the rainy season where the moisture is very easily available in the environment and the virus can get transmitted, and in some seasons like the winter season where it is further multifactorial, it comes in cycles and it produces an outbreak, and hence we have so many cases and so many people get it, right? Particularly if we talk of the winter season, then medically speaking, it is said that the body per se has the ability to produce a lower immune response. So for the body's ability to fight against the virus eventually goes down a little in the winter seasons, because anyway the body has to maintain a particular body temperature, and during the winters the ambient temperature is low. So the body is constantly doing a lot of work, right? And then over and above that, if it has to elicit an immune response against something, a pathogenic or an infectious agent which is entering the body, is a task for the body. So that is why the immunity goes down. Secondly, we all have a tendency of staying indoors as much as possible and close proximity of each other. So if someone is subclinically infected, like they are not showing symptoms but they are infected, and if someone is actively having symptoms, since we are so much in close proximity, all of us are indoors, the ability of the virus from going from one person to another is very easy and very high. So I found this very interesting finding in one of the journals of allergy and immunology. So in that journal, in one of the very big studies they found out that our nasal cavity basically is the place from where the air enters the human body, right? So it has its own immunological barrier to defend the body from any infectious agents which is entering the body. So in that journal they found that during the winter season, when the ambient temperature is low, that immunity goes down. So the ability of the immunity which is there at the entrance only is comparatively low. So all these factors lead to us having higher number of cases of these viral infections.
Doctor, how can we control the spread of viral infections?
Okay, so I think the Indian population by now is very experienced and efficient in this knowledge, very empowered of the COVID-19 outbreak, right? Even that was a respiratory virus which was going around, and all of us, follow something called a COVID protocol and all of that. So just like that, for any viral infection, which has its respiratory symptoms in place, you should cover your mouth with a mask. Then you should maintain respiratory hygiene, that if you're sneezing around people, then you should sneeze here. And then thirdly, you should try to maintain social distance from people who you think you can infect. When you come from outside, and you should wash your hands, you should use a sanitizer, all of these things. But we generally do not tend to keep our nutrition at bay during the winter season, because bhook kam lagti hai, pani peene ka man nahi karta. So low nutritional status, low hydration status is also a reason, because the nutrition in the body eventually translates to the immunity. So eat green leafy vegetables as much as possible, have a seasonal fruit, drink at least 2.5 to 3 liters of water a day. So all these things can be used as a strategy to reduce the spread.
Doctor, are there any kind of tests that you suggest taking for viral infections?
I think that's a very interesting question, because so many of my patients come to me with normal symptoms of cough, cold and fever, and they will themselves start naming 100 tests, CBC, viral profile, fever profile, karwale doctor saab, and all of this. So generally something called as a fever profile, which is the first that we generally tend to do when someone has fever, is done when we are probably suspecting a bacterial etiology or dengue or malaria, right? So those tests are really not indicated. But yes, a small CBC can help. But then again, you would require a doctor to tell you and comprehend that test for you to, tell you whether you have a viral infection through that test.
We would like to have a message from your side for the audience.
All right. So I think it's a very general tendency. आपको सर्दी हो जाएगी, आप जाके अपने केमिस्ट को बोलोगे कि गिव मी सम मेडिसिन, और वो सबसे पहले आपको एक एंटीबायोटिक निकाल के देगा. एंड वो एंटीबायोटिक होगी सिप्रोफ्लॉक्सिसिन, सिफिक्जीम, और इट कैन बी amoxiclavir, azithromycin. These are like very commonly dispensed antibiotics, right? But currently, Government of India, and I think the entire medical fraternity across the world, is trying to get AMR into control, which is antimicrobial resistance, right? Because if AMR is out of our control, we might die of a UTI or like a strep throat. So it is a very common tendency of my patients asking me also for antibiotics for these symptoms. They think that they are improving, but actually they are not. They are only reducing and weakening their immunity, which can further help them fight further viral infections and more bacterial infections. So you should not just go and start popping an antibiotic by asking a chemist or per se asking your neighbor or yourself. You should go to a doctor, tell so and so symptoms are there, and then they will give you some management, and that management is generally symptomatic, right? You will be given some anti-allergy or a pain reliever, or you just have to rest it out, you just have to do some gargling, which is like very normal things, and that will give you symptomatic relief.
Thank you so much, doctor, for joining us and for the words that you have spoken. They are going to be helpful for our audience. Thank you so much.
Thank you.